So here are the issues that we have that contribute to metabolic syndrome. What can we do about them? Well, we'll leave obesity for a second. We know what can be done about hypertension. We've already dealt with the pharmacological treatment of hypertension. So regardless of how your hypertension has come about, if you've got it, then it's appropriate to treat it with antihypertensives and bring it down. Elevated blood glucose, which is indicating insulin resistance. Well, we talked again about those oral hypoglycemics, the drugs which are able to reduce blood glucose levels by various mechanisms. And you remember, hopefully, that the hypoglycemic of choice that we talked about quite a lot was metformin. Metformin is a great one because it does not contribute to weight gain. In fact, it may actually help you to lose weight if you go on to metformin. And metformin has shown itself to have some other beneficial effects besides the hypoglycemic effect. It also tends to have an anti-inflammatory effect. So that's all very good. The high triglycerides and the low HDL levels, well, you've just done that group of drugs that are used to improve blood lipid profiles, and those are the statins. So there is already a range of drugs that can be used to treat the individual components of metabolic syndrome, and those must be used just as they would be if a person had hypertension without the other accompanying problems. Metformin, I've just included the slide that we had about metformin just to help you to remember and to make sense of why metformin might be so good to use when you've got a combination of obesity and insulin resistance. It acts at all of these points. So it acts to increase glucose uptake and utilization by skeletal muscle. Excellent, big tick there. It decreases gluconeogenesis in the liver. Excellent, big tick there. It decreases lipolysis in adipose tissue. Very good, big tick there. But look what else it does. And in this, it is alone among oral hypoglycemics. It acts also at the gut, and it decreases the absorption of glucose from the gut. So glucose in sugary meals that you've had, some of it won't even get into the bloodstream in the first place. There isn't another oral hypoglycemic that does that also. And therefore you can see why it would not only not increase weight gain, but it might help with weight loss. It helps to limit the amount of calories, in the form of glucose anyway, that can be taken up from the gut. So metformin, bit of a wonder drug. Don't forget that drug. So as far as metabolic syndrome is concerned, we have drugs for the hypertension. We have a good drug for the insulin resistance and also to limit uptake of glucose in the first place. We have drugs to help improve the lipid situation. What can we do about obesity? Well, you already all know what we can do about obesity. We all know what we can do about obesity, which is why the top line there is behavioral change. In order to address obesity, we have to, as individuals, be able to change our feeding behavior and our physical activity behaviors. And we all know how difficult it is to do that. We have to relearn how to eat, and we have to relearn how to be physically active. That's the 100% effective way of treating obesity. And that sounds a bit glib perhaps, but it is true that if you can actually produce the behavioral change to increase physical activity and to decrease food intake, then in every single person in which you're able to do that, you will successfully treat the obesity. The reason that it isn't 100% effective is because it's very hard to bring about that behavioral change. Second in the list is bariatric surgery, which is the surgery, and there's a number of different ways of doing it now, in which you reduce the size of the stomach, you put some kind of banding around the stomach, you may actually lop half of the stomach off and make it smaller, or you may bypass the stomach into a smaller chamber. All of these are aimed at reducing the desire to eat such large meals, making you feel satisfied by smaller meals, by manipulating the size of the stomach, because we know that there are signals that come from the stomach when it's full, when it's stretched, which in a normal system would feed into the brain and reduce your desire to eat, reduce your appetite. So bariatric surgery is another method that is used to treat obesity. And at the bottom there are drugs. And we'll look at just a couple of those drugs. What should be said is the effectiveness of these other treatments, both the surgical and the drug treatments for obesity, is that without that behavioural change, they will often be effective only for a very short time, and even then they may not be particularly effective. And of course, in both cases, the surgery and the drugs, there are high levels of adverse effects and unpleasant and downright dangerous effects that are associated with both of those attempts to treat obesity. So they're not without their risks at all. Let's just have a look at this graph that came from a meta-analysis of a number of different studies that looked at the effectiveness of different ways to treat obesity. Now, there's quite a lot of things here. It may not be a particularly good comparison because, as I say, this is a meta-analysis of a number of different studies, and although it's gone over 4 years, these different treatments would have been carried out for different lengths of time, and they would have had various different conditions around them, but there's an attempt to try and unify them and just compare them across the board. So we have to be a bit careful about how we interpret the results of this, because these will be pulled from various different studies. But it's quite interesting to see the degree of weight loss. So we've got weight loss here, and of course the further down you come, the more the weight loss, because you've got -2 kilograms, -4 down to -20 kilograms here over 6, 12, 24, 36 months. So this top line here appears to be advice alone. So advice on what to do and nothing else appears, in this study anyway, over 4 years to have made very little difference to somebody's weight. So just telling somebody what to do seems to have no impact whatsoever on their weight, according to this. This one here, exercise alone, this would have been a study, I'm guessing, that went for 12 months only and then didn't do follow-up, so appears to produce an average loss of 2 kilograms, which seems to have been put back on, or at least partially put back on, within the 12 months of the study. So after 6 months, 2 kilograms loss, and then again, clearly, of at least more than half that by the look of it. What's this next one? Diet alone. Diet alone seems to have caused a dip of a maximum of, what's that, about 5 kilos lost at 6 months, and then a gradual increase, not back to the original average weight, but after 4 years, looks like there was just 3 kilograms loss from the original starting point. The red one is diet plus exercise combined. We get a much bigger initial weight loss, but the same general pattern, which is again over the next couple of years. Not back to the original starting weight, but we don't know, of course, what happens after 48 months here. But a much bigger initial loss of weight. Looks like it's averaging at around about 9 kilos, which then is partially regained. This green one here is meal replacements, which seems to follow a fairly similar course to diet plus exercise. Meal replacements would be, essentially those high protein shakes and things which we have instead of meals. So that causes equivalent dip in weight, but it appears to last a shorter time. The purple and the red here, and purple, are 2 weight loss drugs, and one of which we're going to talk about, and this one which has now been withdrawn from the market, so it's no longer available because of dangerous side effects. Similar overall weight loss. Sibutramine, the one that's now been withdrawn, seems to be going down to a second weight loss at 2 years, which is interesting. But again, a gradual climb up with the other weight loss drug, which is the one which is still available. So a similar outcome to all of the other means that have been used to address obesity. And this standout one is the very low energy diet. And although it's absolutely standout in terms of initial weight loss, minus 18 kilograms it looks like, it's also fairly standout in terms of the amount of weight that is then put back on, presumably after the very low energy diet period ends. Very low energy diets would be these carefully controlled replacement meals. They would be at fewer than 800 calories a day. Now, I don't know if you've ever been on a calorie controlled diet before. Most of us girls have been on several calorie controlled diets, but if you're a reasonably active person and you tried 1200 calories a day, that's doable, but you're pretty low on calories. If you drop that again by a third to 800 calories a day, you'd really notice the drop in calories. But not surprisingly, it's also extremely effective for weight loss. The problem is, of course, maintaining the weight loss. The problem is always maintaining the weight loss. Now, this is unfair for other reasons, in that we've got exercise alone, we've got diet plus exercise, and we've got diet alone, and we've got the very low energy diet. Now, we often see, and you often see it written down, that dietary control and exercise are not feasible as agents of weight loss. What we actually should be saying, and this is what these graphs are no doubt showing, is that in the people who were on these regimes, they were not actually maintaining the regime. I mean, that is the problem. That's what you're seeing with the weight going back up, is that the person is not able to maintain the behavioral change that resulted in the weight loss in the first place. And that's a little bit like saying a drug is not effective when you're not taking it. So to compare, for example, diet plus exercise with the drug and say, oh, well, it was initially reasonably successful and then it wasn't reasonably successful, is a little bit unfair. I mean, to compare anything after you've stopped doing it, perhaps is not so fair. But when we talk about exercise and diet failing to cause weight loss, what we actually mean is the person failed to comply with the exercise and the diet regime. And we all have done that. Anyone who's tried to do it, we've all fallen off the wagon and eaten things we shouldn't have eaten, missed out on exercise we should have taken. But if we'd all been sent to an island where we couldn't get our hands on any extra food and our only meals were placed up the top of 10 flights of stairs, and the only way of getting them every day was to go up those 10 flights of stairs, so that if we were forced to maintain our exercise and only allowed to eat the calories that we should be eating, then we know that for everybody we would get the weight loss that we needed. The difficulty is doing it in our normal living conditions.